Good evening once more. My name is Mary Wanjiku from Minet. I'm a corporate wellness specialist and a wellness manager in charge of wellness programs at Minet. It's a great pleasure to have you with us. Let us know where you're dialing in from on the chat, and also feel free to share your thoughts, your questions, and contribute to this discussion, redefining beauty, as we embrace confidence with alopecia, using the hashtag alopecia awareness, Minet Wellness, and Minet Spaces. Alopecia actually affects men more than it affects women. But for one reason, women are more affected by alopecia more because it is a crown of beauty for a woman. So it has multiple and profound effects on women's self-esteem and body image. Alopecia comes in many, many forms. It can be temporary, it can be permanent, it can be in patches, it can be in whole, the entire of your scalp, you lose hair, and it can also be completely the entire body, what they call alopecia universalis. And we do have Daktari who will be taking us through. At this juncture, I also want to inform you that I do have a co-host, my colleague, Damaris Sailoji, who will be heavily engaged in this conversation. She is also a corporate wellness specialist as well as a public health specialist. July is a very special month for the alopecia community. It is a time when we come together to recognize and celebrate the strength, the resilience, and the beauty of women around who bravely face the challenges of living with alopecia. So, as mentioned, please share your thoughts, your questions, and contribute to the conversation using the hashtag alopecia awareness, Minet Wellness, and Minet Spaces. Now, before we delve into this topic, allow me to share some key statistics on this topic. Approximately 60% of individuals with alopecia experience their first hair loss before the age of 30. This early onset can have a profound effect on their self-esteem and body image, making it crucial to provide support to young individuals dealing with alopecia. Secondly, alopecia tends to peak at around the age of 30. While alopecia can affect anyone, regardless of gender, it is essential to recognize that women make up to 40% of those affected. According to recent research, nearly 2% of the global population will experience alopecia at some point in their lives. It is estimated about 107 million people globally, both men and women, are affected by this condition that we are talking about today. Studies also suggest that up to 90% of individuals with alopecia do have a family history of this condition, and this points to potential genetic factors and importance of further research to understand the underlying causes. Today, we have the pleasure of having Winnie Maina, who will unpack this topic for us. She is the founder and managing director of Jalad Aesthetic Clinic, is a health systems leader, a woman in business award winner, and a clinical dermatologist. She is very, very passionate about hair and providing solutions to women and men in general as they look at hair restorations. If you have questions or you have experiences to share, please feel free to raise your hand or drop a message in the chat. We'll be able to pick it up. And I want to thank all of you for tuning in today. Your presence here signifies the importance of this topic, and together, indeed, we can amplify the voices of women with alopecia, our men being affected by alopecia, and foster a more inclusive and compassionate community. Now, without further ado, allow me to welcome my colleague Damaris to say hello and take it away. Damaris, over to you.
Thank you so much. It's my pleasure to be here. it's an interesting conversation, and it's great. Let's have this going and see what we need to unpack, what we need to tell our people, what they don't know and what they need to know, so that we can all embrace the
All
confidence
right, over to you, Damaris.
and unpack them.
Take it away.
Thank you so much, Mary. Maybe Doc, you can take us through the introduction to alopecia, what is alopecia, and also the causes of hair loss.
Okay, so alopecia basically is a medical term for hair loss. I think Mary has highlighted just a bit of it. But what we need to know about alopecia is that it can affect any part of the body that has hair. This would be the scalp, the axilla, and the groin. So any part that has hair, if it's going through any process of hair loss, we call it alopecia. Something else we need to know is that hair loss is also not easy to remedy. It can affect any people across ages, children, adults, male, female, even race, be it black and be it white. So it's something that needs huge attention as we look at it, and especially when we come into the causes, it's broad. We're looking at both trauma. I'll just try to make it as simple as it can so that our listeners can understand. We have majorly classified that into four. We have trauma, we have some medical conditions, we do have genetics, and also there are some medications that you could be taking that can make you lose hair. So we'll be unpacking how these four issues can bring hair loss to you.
Thank you, Doc. Are there any predisposing factors for hair loss? Is it something that is genetically inherited? Please highlight on that.
Okay, so the predisposing factors, again, we get to see them after we have done the evaluation and the diagnosis. There are class of let's we've just mentioned about the causes. There when we say like genetic predisposition, that is a cluster of hair loss in itself. Again, let's say now African women of African descent, we tend to style our hair as often. I know it's hard to manage, especially because of the curl type. So you find now and then we're braiding, we're plaiting, and we're not giving ourselves time or even the scalp to recover. So some of these things will predispose you to hair loss. Again, when you come into the hormonal aspect, pregnancy in itself, pregnancy and childbirth will give you some form of hair loss. Age is also a predisposing factor. We find that by the time both genders, female and male, we are at 50, about 50% of these persons are experiencing hair loss. So it's quite broad. There's quite a number of predisposing factors that we'll be looking at.
Thank you, Doc. When should one see a doctor when they are suspecting that they are starting to experience alopecia?
Okay, so the first symptoms and sign, you see, alopecia mostly by the time the clients are coming to see us, it's affecting the scalp. Some will not even notice that the brows have an issue or the groin area or even the axilla, but they'll start to say my hair is having a patch or I'm losing hair. So the first signs that there is something wrong is, every day we lose some aspects of hair depending on the stage. We'll be discussing that as well. It's because the hair goes through some cycles of growth, some resting phase, and also some shedding phase. So every single day you're losing about 50 to 100 hair strands, which is normal, which is physiologically normal. But then when you get to a point where maybe you're showering in the shower or in the bathroom, you can see strands of hair, or when you look at your comb, you're getting so much than you have been able to experience before. These are signs that something is wrong and you need to seek medical attention. Another thing I would also add is that you might start to feel that your scalp is quite itchy, it's sensitive, it's painful, or anytime you're going to your hairdresser, you're starting to feel pain and you're always complaining that your scalp is tender. This could point to something that is happening and that needs to be checked.
Okay, thank you so much. Say something to the ladies, especially on hair loss as a result of hairstyles. Maybe you can advise on which particular hairstyles are harmful and can predispose one to alopecia?
Okay, so as African women, I know now and then we'll need to style our hair, especially. I do understand, it's curly. For some people, quote unquote, they'll say it's hard to manage. But anytime we are braiding, we need to be very gentle to our scalp. Um, this is information we're also sending across to our hairstylists, because I remember, or you can maybe remember an incident whereby you left the salon and that day you couldn't sleep because of the pain the braids are impacting, on your scalp. So this is a sign that there is too much pressure being put on your scalp. So we need some gentleness in handling our scalp. And again, the heat from the hair dryers, if you can be able to manage your hair by just normal drying without using too much heat, that'll be okay. And then when we're doing the styling, maybe using relaxers, can we not over process this? Because all these factors, at the end of the time, anytime we are diagnosing hair loss, we tend to find some conditions lately that are associated with our hairstyling over time. The first time you might not notice anything, the second time so, but by the time you go into the third and the fourth year of the same particular styling, there is already some significant hair loss. Yeah.
Okay, thank you. I believe we've taken note of that, especially ladies on the call. How do we diagnose alopecia?
Alopecia, let's say like it's a sign or something we'd call a symptom. Anytime you go to the doctor, there's something you're complaining about. That is what we call a symptom. But when you come in, when we assess, that is a sign. So it's a sign of something happening, because like Mary had said at the beginning, it could be just affecting the scalp, or could be just a manifestation of a systemic illness. So when you're seeing the doctor, there is a lot of clinical history that is done. There is the examination, and this is what gives us a clear guide of the investigations that we need to do. These may include some blood analysis. These may include some samples being taken from your scalp for even analysis, but the history and the clinical examination is a guide that gives us an insight of the investigations that we need to do, which are quite a number.
You mentioned that there are some illnesses that are associated with hair loss. Maybe you can shed more light on this.
Okay, so when we look at the illnesses, we're looking at dermatological conditions, which purely affects the skin. And there are also systemic conditions, meaning you hold within your body that are manifesting as a form of hair loss. So if we look at the dermatological conditions at the skin level, some can give you reversible form of hair loss, and some can predispose you to something called scarring alopecia. Alopecia that this disease process has affected the hair follicles to the point of it cannot be recovered. So I'll break them down into two. We're looking at the skin conditions, and we're looking at the systemic illnesses. If we look at the systemic illnesses, I'll just give an example of like iron deficiency. We are talking of thyroid dysfunctions. We are talking of conditions like even polycystic ovarian syndrome, which also gives us alopecia. When we look at the skin conditions, you've seen kids also something people like to call mashilingi. That is a fungi in the skin and can cause hair loss. There are other autoimmune conditions like alopecia areata. Probably you've checked on alopecia that cause hair loss, but this is not permanent. So these are just a few, because when we're doing the investigation, there is a broad coverage of these conditions, and they'll be guided. As we narrow down to one, we are guided by the investigations that we do and the diagnostic modalities that we have. So systemically, talk of mineral deficiencies, they can cause hair loss. Talk of thyroid dysfunction, that can cause hair loss. And even recently, I'm sure you've heard people talk of SLE, or systemic lupus disease, or even acute or chronic diseases that have had so much pressure on your system, and they can cause hair loss. So these are some of the things that we look out for. And one thing to note is that if we diagnose or we suspect that the hair loss is due to systemic illness, now it becomes a multidisciplinary approach, because we tend now to involve the physicians. If it is the point like PCOS, we're bringing in the gynecologist and all that. So it becomes a multidisciplinary approach so that we can get the results that we intend to do.
Awesome. Thank you, Doc. Is there a way one can prevent hair loss, or is it possible to stop alopecia completely?
Prevention measures are like some of the ones we have discussed. And then the aspect of stopping hair loss indefinitely is almost not possible. Remember, we said the hair goes through cycles. There is a growth cycle, there is a resting phase, and there is also a shedding phase. So if we mean to stop the hair loss indefinitely, it depends at the point of diagnosis, whatever is affecting your hair or whatever is causing the hair loss, at what point of the hair growth cycle is it affecting it, so that we are able to address the condition or the specific illness or the specific situation at the stage at which it is affecting the hair loss. So yeah, it's possible to stop, yes, but again, it depends at what point is whatever causing the hair loss it is at that particular time.
Okay, thank you so much. Maybe you can shed more light on the various phases of hair growth and how we can take care of our hair at each cycle.
Okay, so when we're talking of the hair cycle, we have something called the anagen. This is the growth phase. This is the longest phase, and we're talking of about 2 to 6 years. Actually, the anagen is what gives us an insight of how long your hair grows. We normally say at least your hair will grow by a centimeter every month. The anagen phase usually has some genetic determinant in it. That's when you find people of a particular family, they have these amazing long hair, and for some other people, yeah, maybe it doesn't grow as long, but it's okay, it's healthy. So the anagen phase will go for about 2 to 6 years, and then we go to a resting phase. This is about two to 3 weeks, and then there's another phase that comes by 3 to 4 months. They are dormant years, and then we end to the shedding phase. So anytime we are looking at improving our hair, we are targeting the anagen phase, okay? And the anagen phase is that we want to keep our hair growing as long as possible and in a healthy state. So some of the things that we're looking at is the nutrition, the lifestyle, the health, and all those factors we said about styling will come in handy so that we are not getting breakages, because all these phases, they do not happen at the every time your hair, your scalp, they are not synchronized. There is a section of your hair, about 85 to 90% of your hair it's at the anagen phase. There is 1 to 3% in the catagen, and about 3 to 10% in the telogen phase, or the shedding phase. So you find all these things are happening at the same time. But our intention to make you having that voluminous hair is to keep the anagen phase healthy and growing enough, because all these diseases that we've been discussing, for some people to notice there is significant loss, there is some injury, or there is some effect at the anagen phase. So we're looking at the healthy lifestyle, the styling, the diet, and micro and mineral issues that we need to keep this hair going. Some things may not be possible to change, let's say pregnancy and childbirth. Others, maybe you're going through some treatment, but when these phases are gone, your hair is gonna come back.
Okay, thank you so much for highlighting that. Maybe you can also explain on the role of nutrition in prevention of hair loss.
So when you're looking at nutrition and hair loss, there are specific minerals that are known to support the anagen phase. You remember we've talked of our intention is to keep the growth phase healthy and growing. So the minerals and vitamins that support this phase is what we intend to bring to the table. Let's say we are talking of iron, we are talking of vitamin B12, we are talking of biotin, we are talking of minerals like zinc, copper, and all that. So when we're having, our healthy diet should be able to bring these minerals sufficient enough to keep our hair growing. But then it's important to be keen. Especially, let me talk about the vegans. There are people who are strict vegans and they do not eat meat. You find their iron level needs more supplementation, basically because our body is not able to absorb very well the non-animal iron sources. So we need to be keen with these minerals so that we are able to have them all from our diet. But in any case, we suspect, let's say for those people who go through fasting, maybe you're losing weight, maybe you've gone through surgery, maybe you're going through a stressful situation in life. If there's something happening out of the ordinary, it's good to check with your healthcare provider because we're able to analyze, we're able to send you to the lab and do these analysis for the minerals and supplement them appropriately.
Thank you, Winnie, for that. I hear so many people say that the reason why they are losing hair is because of stress. Does stress play a part, or rather a role, in hair loss?
Yes, it does greatly because hair, I mean, hair has two parts. We have the shafts that we see. What we see is the hair shaft. And then under the skin, we have the hair follicle. So the hair follicle and the cells that make hair follicle, like any other part of your body, if you're stressed, there's an effect to the cells that are rapidly multiplying. So that is why you find stress or stressors can aggravate hair loss. It's just a normal cell like any other.
Thank you for that. The other question, which would like you to take more time in, is there hope for those people who are experiencing hair loss? Are there any home remedies, and what are the possible treatment options for hair loss?
Yes, there is hope, but again, we usually will say the earlier the diagnosis, the earlier the better. And then again, there is no one shoe size that fits all treatment for hair loss. Because you remember we discussed earlier, there are some issues that will cause permanent hair loss, okay? And then there are some issues or some diseases that the loss they cause is temporary, meaning this patient or this client will be able to recover the hair. So in the event someone is going through a condition that causes something called scarring alopecia or permanent hair loss, the challenge is that if they take too long, by the time we are bringing the intervention methods, we are not able to recover that hair, the hair that is already gone, and then we start thinking through surgical intervention, just maybe to bring the hair back. But what Nick I would like to highlight is the moment or the very day that you realize there is an issue, seek treatment that particular time, because the earlier the better. But yes, there is hope, depending at the stage where the diagnoses have been made. I have seen situations whereby we have to make peace with the situation. It's a sad situation where one has significantly lost hair so much in that a way that we do not have any solution for that area. So then it's a multidisciplinary approach. There is the emotional, there is psychological well-being, even coming into terms with that they have or they're gonna live with this condition maybe for the rest of their life. But the earlier the better, because treatment is there, interventions are there, and our mainstay is usually to prevent further hair loss at the point of diagnosis, and if possible, recover and restore what has been lost.
Okay, Thank you so much. Maybe you can elaborate on the treatment options and probably their cost in the market.
The treatment options, again, Damaris, like we said, will depend on the condition that is causing the hair loss. All right. So you find some are even topical. It's just a skin disease issue topically that is causing the hair loss at that particular point. There's some medication we're able to prescribe, and within a few weeks, they are able to start recovering their hair. Others, it's a journey that will take even months. Let's say we got to the diagnosis, we're dealing with autoimmune mediated form of hair loss. We need to bring in treatment maybe for a very long duration of time because we intend to stabilize that immune response that is causing hair loss. And then for others, by the time we're getting to the diagnosis, the hair has been completely lost, yes. The scalp is stable and we're able to do things like you've seen hair transplant, basically get some follicles from other areas of the scalp and implant to the area of need. So purely the treatment option is tagged to the diagnosis. And that is when we discuss with the client, this is what has been going on, and this is a treatment option that may be able to help. So it's a journey. It's not a one day off form of treatment that they get them restoring their hair.
Maybe you can shed a little more light on the hair transplant. Is it for everyone? On what basis do you use to determine whether somebody qualifies for, the hair transplant or the other options that you talked about can be applicable, especially when the hair loss is irreversible?
Okay. Thank you, Mary. Hair transplant is not for everyone to start with, because you remember we mentioned the cause of hair loss. Because what we're looking at hair transplant is harvesting hair follicles from your scalp and bringing it to the area of need. So in the event the diagnosis does not support the hair follicles that we need to transplant, outrightly we are not able to go ahead. And some of these issues is like when you have autoimmune disease process happening, because when we bring in the new hair follicles to the area of need, certainly at some point in life you're going to lose them. So it beats the cost benefit analysis. But the two top conditions that outrightly will qualify for hair transplant is like traction alopecia. We'll talk a little more about that, or even male pattern balding, like what you've seen men bald, and maybe you have had trauma. There are people who have had burn wounds affecting their scalp and their hair has been completely affected. When we have trauma and genetic form of hair loss, these are some of the candidates that would say we have hope that once we restore the hair, because the hair that we harvest is resistant to the genetic thinning process. These are candidates that we say the scalp is healthy and we may not have issues even after we transplant.
All right. Thank you for that clarification. Maybe also you can tell us about, I hear there is a new treatment called PRP. Would you please shed more light on how it's applicable, what it is, how it's done?
Okay. Yes, there is a treatment we call the platelet-rich plasma therapy. So the modality is that we get a small section of blood from the patient. We take it through centrifuge machine and separate the plasma from the red cells. Scientifically, the plasma is what carries the growth factors with it in our system. So we all have these going on in our body, but the concentrating these using the centrifuge machine, we basically trying to increase the concentration of those growth factors to maybe 5 to 10 mils of your blood, or 5 to 10 mils of your plasma. Then because this has the growth factors, we come and inject to the area of need. However, platelet-rich plasma does not restore lost hair follicles. So in the event your diagnosis pointed to scarring alopecia, where you have completely lost your hair follicles, then outrightly you're not a candidate for this platelet-rich plasma. Because the role of the platelet-rich plasma is to bring these growth factors to the hair follicles that are already being challenged, maybe because of trauma or you have had a disease process, but the follicles are present. So it just we like rejuvenating, make those hair follicles get the girth and the energy. You basically, the way we plant and want to put fertilizer, you want to add just a bit of them to keep growing. And then platelet-rich plasma is known to increase the anagen phase. Remember we discussed the growth phase being the anagen. They're known to prolong the anagen phase. So it gets your hair growing for a relatively longer period.
All right. Thank you very much. Damaris, you're back. Over to you.
Yes, thank you so much, Mary, and sorry for that. Thank you, Doc. There's a question. What causes graying of hair and what is the treatment remedy?
All right. So graying of hair has two aspects into it. Graying of hair has the aspect of the genetic predisposition. This is to say that if your folks tend to start graying in their 20s, in their 30s, chances are you might also go through the same. The other aspect is aging. As we age, the cells that produce melanin is a color, what gives us the skin color, what gives the hair the dark or the black color. As we age, the cells that produce melanin, we call them melanocytes, they tend to slow down, or even at some point towards the very elderly age, they completely stop to produce this melanin. So that is why we get graying. Unfortunately, so far we don't have a solution for graying, and you might end up doing the color. Yeah.
All right, thank you, Doc. Is it true that we lose more hair as we get older?
Yes, it's true. I'll bring the aspects of both men and women because it's different, and the kind of hair loss that we get as we get older, especially with women, it's called the female pattern thinning. You tend to find especially on the top. And then for men as well, there is the genetic balding. So what happens with women as we get older, the level of estrogen and progesterone is coming down. So what happens especially with women when we're getting the peri and postmenopausal is that the level of estrogen and progesterone start coming down. All right. So at this point, remember, both us as women, we also have the male hormones, which we call androgens. And because the estrogen and progesterone is getting down, the effects of androgens start being felt. And some of the effects of androgen to the hair, especially in women, is that they shorten. You remember I said I'll keep referring to the anagen, the growth phase. The effects of androgen, they tend to shorten the anagen phase of your hair, meaning it's not growing as longer as it used to be. And the other effect of androgen to the hair is that it thins or causes something called miniaturization of the hair follicles. So as we get older, especially women, this might happen that the hair is not growing as longer and it's also thinning. And that is still the same science that makes the men bald. Though for the men now, there is the genetic predisposition of the male pattern balding.
Thank you very much. Is there a treatment for baldness?
Yes, Damaris. Yes and no. I think we had covered that because baldness. We are talking of. May I get your question right? Baldness in men or the balding
In
women?
men.
In men. Yes. Again. 50-50. I'll say 50-50 because of this. At what point do they present? If they present early enough when they have noticed that the thinning is starting, these are the time we introduce some applications to the hair to support the hair growth, and they're not shedding more. If they present at a point where the hair follicles are already gone, completely dead, we are able to do now what we call the hair transplants. And again, for the hair transplant, we assess for the candidature, because the balding in men is again classified at the level of how much they have been able to lose. To see is that when we are transplanting, we are removing a section of the hair from a certain area and we're bringing it to another area. So it's an issue of donor versus the supply. So in the event that they have lost so much than their donor can support, we need to be discussing the phases of hair transplant, or if this hair transplant going to give them an aesthetically sufficient look. That is one. Or is it going to be a combination of treatment option so that they can feel confident enough, because they are combination approach that we use. You can do a hair transplant, and there are some other issues like scalp micropigmentation, just to give them a look that they are confident about. Yes, so there is a solution.
Okay, thank you so much, Doc, for highlighting that. We encourage each one of us, you can write your questions on the chat and we'll be able to engage you as we proceed. Maybe you can tell us more on where we can find you. If you need, any one of us wants to see you, you can advise on how we can be able to find you, your contact details, and what you do.
So I sit at Jalad Aesthetic Clinic. We are at the Family Health Options Plaza. It's along Langata Road at the Timol Junction. On that floor, we are open every day of the week from 9 to 5 p.m. And any of us will be needing my help, consultation, or insights on hair loss and how we can go about it. I'll be really, really glad to help.
Thank you so much. There's a question on how often should one wash their hair, especially for women?
Okay, usually we recommend once or twice a week. Again, it depends with the environment and the hair care practices. But once to twice a week is enough. And again, we also advise on the shampoo that you pick, especially for the African hair. Be keen on to pick the shampoos that are sulfate free. We recommend this so that you're not stripping off the natural oils of the skin, because they're really needed for the healthy and health of the scalp and the growing of hair. So let's say once or twice a week, depending on your hair care practices, exposure to the environment, and all that. I know when we braid, we tend to keep even a whole 2 to 3 weeks. So yeah, it depends on the hair care practices that you have as a person.
Thank you, Dr. for that. We have another question. Does wearing a hat or a cape cause hair loss?
No, it doesn't. That is a myth.
Okay. Thank you. Any other question, please engage us on the chat. We'll be able to address them as we proceed.
Also feel free to raise your hand to contribute to the discussion. If you have any insights or experiences that you have with hair loss, please kindly raise your hand and contribute to this discussion. And then, Daktari, maybe you can also advise on the issue of swimming. Does swimming affect our hair in any way negatively? And if so, what can we do about it?
Yeah, I've seen it. It's very hard to know the level of chlorine in our swimming pools. So usually we advise, if you going into swimming, if you're able to wear your swimming caps, the better. But if you're not, immediately after, you need to rinse off your hair. And if this is the time that you shampoo and condition, because the chlorine tends to dry and strip off our hair the natural oils. So that is how negatively it can affect our hair. So if you can wear the swimming caps, the better. If you can, shampoo and condition your hair after.
Okay, thank you, Doc. We have more questions coming. Let's keep them coming. Does straightening of hair stroke blow dry cause hair loss?
It doesn't, but again, like we said in the beginning, our hair practices need to be friendly. Do not use too much heat. Just be gentle to the scalp. Number one, it can cause either breakage, or in the long run, we have had some hair loss conditions associated with our hair care practices, especially over processing and use of too much heat on our scalp.
All right, thank you, Daktari. There's another question. What are the treatment options for alopecia areata?
Alopecia areata is an autoimmune disease process, meaning it's your own cells attacking the hair follicles. Remember, we said the hair has two parts. There is the hair shaft, and there is the hair follicles in the dermis of the skin. So what happens in alopecia areata? It's autoimmune. There is an immune dysfunction where your own white blood cells attack the hair follicles. So when you are treating alopecia areata, there are two modalities. I hope our listener will understand, but we use intralesional quote-unquote steroids, immune modulators, and there's some also topical creams that are immune modulators. Once we use them for alopecia areata, we get our hair growing. We just need to modulate that dysfunction immune challenge that is happening at the level of hair follicle, and we'll be able to get back our hair. Because again, the good news is that alopecia areata is reversible. It's not a permanent form of hair loss.
Thank you, Daktari. There's another question on hair loss. Does chemical or hair relaxers have a negative effect?
Yes, if not used appropriately, like we've just said, if you overprocess with the relaxers, maybe they are taking so much time on your scalp. In the long run, because you're doing this now and then, there are chemicals. It will cause the chemical injury to the scalp. So we always have instructions. Even when you look at those relaxers or the chemical, there are instructions of the number of minutes or the number of seconds that they should sit into your scalp. But most of the time, we even get clients or patients coming in with a chemical burn. So these burns eventually might cause hair loss. So we just need to be very careful when we're doing this.
Okay. Thank you for that. Let's keep the questions coming. We have another question. I think this is directed to us. Does Minet cover this for teachers? I'll comment and then allow me to add something. Most insurance policies treat hair loss as a cosmetic procedure, and hence most of the time it's an exclusion. However, being a broker, we are making a lot of strides in negotiating to make sure that it's also, especially if it's caused by a medical condition, to make sure that this is covered. It is assumed that hair loss is a cosmetic, or hair treatment is a cosmetic procedure, and it does not really affect your daily activities like a medical injury does. But I'll allow Mary to also comment something on that. Mary?
Yeah, thank you, Damaris. So just to confirm that when it comes to hair treatment, if it's relating to a particular disease, for example, as Dr. was saying, if it is being caused by ringworms like the tinea, definitely that one is covered, and you can see a dermatologist or your doctor for that. So what is not covered are the procedures, the other procedures that Dr. was talking about, the procedures around implant, the procedures around the PRP, those are not covered because of that aspect that they are considered as cosmetic. But as a broker, we are always there to lobby for our clients, and many things that have been exclusions within the insurance industry, we have been able to lobby things like family planning, things like even fertility treatments that teachers are currently enjoying. It is through the lobbying and efforts of brokers like us, Minet. So we'll continue doing that. And if you do have some form of hair loss, do not fret, just fret, do not fret, just visit the doctor or dermatologist, and they will be able to make a proper diagnosis and advise you on the way forward and offer you the relevant treatment options. Back to you, Damani.
Thank you, Mary, for making a clarification on that. I'll give back to Winnie to give her closing remarks. And thank you so much for listening to us. Winnie?
Damaris, allow me to interject before she closes. Daktari, maybe to our final question, especially for women and men living with permanent hair loss. I know there's a lot of stigma out there. How can we as a community, what can we do as a community to support people living with alopecia or the permanent hair loss, what is commonly known as baldness?
Thank you, Mary. This is something we're looking at being our social responsibility as experts or people who have insight on what is happening. Because the biggest support system for people living with alopecia starts with the people around them. So anytime we are doing treatment or we're consulting on anyone who has alopecia, we tend to ask them to come with a caregiver. Let's say it's your son, it's your daughter. Take them with them to the doctor so that we listen and you're able to offer that psychological support. The other aspect we are giving the approach on is the hair care stylist or the hairdressers, because to give an example, I had a client who cannot do or even wash their hair in the salon because she feels anytime she maybe removes her wig or is going into the shampoo area, everyone drops what they're doing and they're looking at what she's going through on her scalp, which is really, really a psychological torture or the pain, and she has to do this in her home. So the sensitization or sending the information out that any person going through alopecia, it's a disease and a disease process like any other. So we're talking of the social responsibility, being able to support people going through the disease process or alopecia, and even counseling and support groups that they're able to embrace the being. Remember, we said there are some scenarios where we are not able to revert or completely cure, and they have to live with this aspect, the new aspect of their life, and maybe for the rest of their life. So bringing them together, talking to the team players, because it becomes now a multidisciplinary approach with the people they are with at home, the salons or the spas where they go for their hair care, and the people they interact with, even at their social and workplaces. So this is what we're doing, just sending out information that it's okay, it's a disease process, just like the way we wear masks because we have a cough or we have a respiratory tract infection. Alopecia is also a disease process and a condition, and we need to start getting that acceptance from the social level, and I'm sure we shall get there. And I've already started seeing people embracing that, and I think we are on the right track forward.
Yeah, thank you very much. And I also want to remind everyone that at Minet, we do offer free counseling services, and you can get in touch with us through our toll-free number, 0800 720029. And we would be able to walk with you in this journey. So you're not alone. We are going to stand with you. Feel free if you're struggling to cope with hair loss. In addition, also note that there are support groups here in Kenya where people that are suffering from alopecia have come together to encourage each other. And some of these groups, you can find them in the social media platforms like Facebook. So if it's a condition that is affecting you, kindly feel free. That support is very, very important. Daktari, as we come to a close, kindly give us your parting shot. What should we take away from this session?
Thank you, Mary. So, my parting shot will be for yourself, for your sister, for your brother, or anyone else that you know is going through this condition. Just let them have to see a doctor, a dermatologist, a doctor. Let them have the consultation so that they get the right diagnosis to start with. Because the biggest pain that my clients have expressed is having spent so much economically on some form of hair loss in terms of purchasing products, trying to apply this and that, and have spent such a fortune that has not been helpful. So let's have them get assessed as soon as they can. Let's have them get to know what is happening so that they find closure or a new beginning in terms of treatment journey. And then all this will make them settle emotionally, psychologically, and I'm sure we'll be in a better place with this. Thank you so much.
Thank you so much, Daktari. As we come to a close, I want to take this opportunity to thank Winnie, Daktari, for a very, very insightful session on hair loss and how we can redefine beauty. To my co-host, Damaris, thank you very, very much for taking us through this session. And to each and every one of you who joined us in this discussion, we are very, very grateful because this is the first step of supporting people that are living with alopecia and also empowering ourselves to ensure that, we are able to protect our hair and, keep it healthy through the various tips that Daktari has offered, in terms of, diet, how we take care of our hair, in the sense of if you're going to swim, we're going to wear caps. If you're a vegetarian, you need to take supplementation, among other things. And probably before I wind, I know there are some questions that have just come in. Damaris, can you take that kindly?
Thank you, Mary. We have addressed most of the questions on the chat. I see a comment saying that this was educative. Thank you. Yeah, so we've already covered all the questions on the chat.
All right, that's okay. That's in order. Thank you very much, Damaris, for that confirmation. Just checking to ensure that we haven't missed out any. But thank you, everyone. This is a very important topic. Let's continue supporting people that are living with alopecia. Let's remember it's not just a physical condition, but it is also an emotional journey for those that are affected. Let us all continue to support one another, spread the awareness, and be understanding allies to people living with alopecia. If you found this session helpful, don't forget to follow us, Minet Kenya, and the panelists, to stay connected and continue with this conversation where we're using the hashtag alopecia awareness and Minet Wellness. Together, we can definitely make a difference and create a more informed and empathetic world for everyone. So thank you, everyone. Let's keep out an eye for future Twitter spaces. We have a lot more and more that you're planning to cover so that we can continue to build a very supportive community, get to learn, share insights, and grow together. Until then, take care, be kind, and remember that your voice matters. Thank you, everyone, and do have a lovely, lovely evening. And bye-bye for now.